things that we're going to do is to be completely transparent, open, and honest. If things go wrong, not point fingers, but to correct them. The other half was longing for clarity, longing for facts, longing for truth.
Dr. Fauci, thank you very much for being with us today. And let me ask you, first of all, how concerned are you about the different variants of the virus? Is it just more transmissible? Is it also more mortal, more dangerous? What's your assessment of that?
Well, there are a number of variants that we're dealing with. We take all of them seriously. Some are less concern than others, whereas some have a degree of capability that makes one concerned and making sure that the vaccines that we have address them. For example, the variant that is dominant in South Africa is called the B1351 variant. We know that not only does it spread rather efficiently, but when you look at the protection that you'd expect from some of the monoclonal antibodies and from the antibodies that are induced by the vaccine, some of the effects of the monoclonal antibodies are diminished, if not essentially eliminated. But the antibodies that are induced by the vaccine are diminished by about 5-fold in their ability to contain the virus. That's the sobering news. However, what we do know that some of the vaccines, for example, the vaccine that is the mRNA from Moderna and from Pfizer, and the J&J vaccine, when you look at them, even though it diminishes somewhat the capability of the vaccines still protect very well from very severe disease, such as hospitalizations and deaths. There are other vaccines that may not be as effective against that variant. We have other variants, for example, the 117 that started off in the United Kingdom and UK. That one we know has a clear capability of spreading more efficiently from person to person. However, the vaccines seem to do pretty well against that, even though it spreads. The Brazilian variant is very similar to the variant in South Africa. And finally, we have a few variants in the United States, one in California, which is the 427, 429, one in the New York City metropolitan area, which is the 526, that are giving us a problem because they spread pretty easily and they do diminish somewhat, not a lot, but somewhat, the effect of the vaccine. So the bottom line summary is we've got to take them very seriously. Some of them are more problematic than others, but we've got to continue to do surveillance, namely do genetic and genomic sequencing of the strains that are in the individual country. I would be very surprised if Greece did not have their own variants that they need to make sure that they look out for, because they may need to make sure that the vaccines that they're using are actually effective against the mutants.
Now, as you know, there was a lot of discussion about the potential side effects of the vaccines. Based on what you've seen so far, what is the level of your concern?
The level of my concern is minimal. And the reason I say that is that in the vaccine trials that we did in the United States with the mRNA from Pfizer and from Moderna, they were really, well, we know they're very highly efficacious, 94 to 95%, but the reactogenicity is minimum. After the first dose, You get a feeling of achiness in your arm that lasts for about 24 hours. There's more reactogenicity after the second dose, and that occurs 21 days later with Pfizer and 28 days later with Moderna. What happens after the second dose is you can get a feeling of fatigue, of achiness, of some chillingness, and maybe a little bit of a fever. That only lasts in most people for about 24 hours. Some people a little bit longer, but the overwhelming majority of the people, it lasts for 24 hours, and then it goes away spontaneously and you're fine.
Now, everybody has asked me to ask you the question, if you had to choose, which vaccine would you prefer?
You know, it does not matter to me. I think all of them, the ones that are now been approved for emergency use authorization in the United States are the Moderna, the Pfizer, and the J&J. I would take the one that was the most readily available to me. I wouldn't wait for one. If I walked into a clinic and they had this vaccine, I would readily take it. If I walk into a clinic and they have another vaccine, I would readily take that one. Some of them have more advantages one way. For example, the J&J is a single shot, so you don't have, it doesn't require to be frozen because it only can be put in a refrigerator. So there may be places in Greece where it is less easy to get things shipped to because of the cold chain. You might want to use one that's more easily usable from the standpoint of refrigeration. On the other hand, if you're in the middle of Athens and you have a lot of the facilities to do things, you might want to get one that's the prime and the boost. But with regard to efficacy, all three of them are really quite efficacious.
Would you do the Sputnik or the Chinese vaccine? I was wondering.
Well, the data that I've seen from the Sputnik look pretty good. I don't have as much information of the Chinese because the Chinese have 2 or 3 different vaccines. So I have not followed carefully the relative efficacy of them. But the data that I've seen from the Russian one looks pretty good.
Now, as you know, there's a lot of debate about whether in some cases, when countries are on the brink of another wave, there should be only a one dose of the Pfizer or some other vaccines. What's your view on this?
No, I do not like that approach for the following reason, is that we have shown that, take the Pfizer vaccine, for example, after the first dose, you get a modest amount of antibody level that's good enough to maybe protect 52% as opposed to 94, 95. It does protect well. 52% is not bad. We don't know how long it lasts. When you give a boost, the level goes up 10 times higher, so that when you're dealing with the variants diminish the efficacy by maybe 5-fold down. So if you're starting off at a very low level with a single dose, it may be good against the regular virus, but when the variant is around, it could fall below the level of protection. So even though it has the advantage of giving more vaccine to more people right away, it has the disadvantage that you don't know how long the protection lasts. And you could get into trouble if you're dealing with variants in Greece, as opposed to the standard virus. So the science tells us that the least risky thing to do, and the more confident we are, is a single dose followed by the second dose.
I want to ask about herd immunity now, because I remember you saying a few months back that you would be comfortable at the 60% level. Now you say that it's the threshold is about 80%.
Yeah.
What has changed? What's the final assessment? Let's put that.
Yeah. Right now, again, we have to realize that it is just an estimate, because the only way you know about what the exact level is when you get there and then you fall below and infections occur. So we know exactly what it is with measles because we have decades of experience with measles. We know that the level of herd immunity is about 90% of the population. Once you get into the 80s, as we've seen in our own country, when certain pockets of people in the community got below a certain level, we had outbreaks. With regard to COVID-19, we can only estimate what it was be. And the more we're looking at the degree of spread, about the level of efficacy of the vaccine, we think it's about 70 to 85% of the population, somewhere between 70 and 85. But I must caution you, that still is just an estimate.
Okay. Now, we have a big debate here in Greece because we're experiencing a third wave. And there's a debate about whether schools should be open, whether retail stores should be open, movement in the streets and all this. What's your recommendation? What's your suggestion?
Well, one of the things that you have to do is I don't know what the level of the surge is, about what percent positivity testing is. You know, in the United States, we have blue zones, yellow zones, orange zones, and red zones. Blue is the test positivity from 0 to 9%. Yellow is from 9 to 50%. Orange is 50 to 100, and red is greater than 100. So if you are in the very, very far red zone, you've got to be very stringent with public health measures. You know, you've really got to, no indoor dining, close the gyms and things like that. If you get to a more modest, there are 4 or 5 things that you should do anyway. Uniform wearing of masks, avoiding congregate settings, particularly indoors, keeping physical distance, washing your hands very frequently. It really depends on the level of penetrance of infection in the community to determine what level of restriction you're going to put on the country.
Now, I heard President Biden the other day saying that most of the US population is going to be vaccinated by May.
No.
Okay.
He said, okay. He said, by May, we will have enough vaccine to vaccinate everyone. The logistical challenge of getting everybody vaccinated will likely take multiple months more. We'll have enough vaccine by May, but if you want to get the 70 to 85% of the people vaccinated, it likely will take well into the summer, towards the end of the summer.
So you think by early fall, everybody will be vaccinated probably?
Not everybody, because we have a lot of people in the country who don't want to be vaccinated.
You still have that?
We still have vaccine hesitancy, yes.
Now, when you look at Europe, what do you think is Europe? Is Europe doing something wrong? Because we seem to be behind the US in terms of getting our logistics in place.
Well, it depends on what you're talking about, Alexis. Logistics about vaccines, or just logistics about the outbreak
about vaccines.
About vaccines. Well, I don't think you're doing anything wrong. It's just that different countries have different capabilities. What President Biden has done is he's made this a very top priority of implementing getting the vaccine into the arms of people. For example, he's created community vaccine centers, particularly in those areas that might be underserved by the healthcare system, which is very heavily weighted towards our minority populations, African Americans, Hispanics, and others. The next, he's put vaccines into the pharmacies to be readily accessible to people. Next, he's created mobile units to go into areas that are not easily accessible. And he's got a lot of people who are called vaccinators, people who will be doing the actual injecting into the arms of people. He's gotten our National Guard, our home military. He's gotten retired doctors and retired nurses to come out of retirement to help to administer. In the beginning, when he first took over, we did not have that in place. And the administration was not as well organized as it is now, where you have a very well-organized plan to distribute the vaccines.
Do you think there might be a cure for COVID? We've heard about some promising research in Israel, for example. Do you find any potential in all of this?
I think that just the way we developed good drugs for HIV by targeted drug development, and just the way we developed good drugs for hepatitis C, I think with a good investment of time and resources, that we will ultimately have very good drugs for COVID. But I don't think that is going to be immediately. I think it will take a little while.
Now, when do you think we're going to have a D-Day in terms of the pandemic? When we can really say that this is all over and we can go out in the streets and celebrate?
That is difficult to predict for the following reason. It would depend on the individual country. This is a global pandemic, which requires a global response. And one of the things is that until we get vaccine available globally, Greece could do a good job in getting their people vaccinated and suppressing the level of virus to a low level. The United States could do a good job, the European Union, the UK, Australia. But if there is still parts of the world that don't have the capability of vaccinating their people and suppressing the virus, there's always the danger that new variants will come and reseed Greece and reseed the United States. So I think we can get it down to a very low level. I hope that by the end of the fall and the end of this year, 2021, that we will be able to approach a significant degree of normality. Maybe not absolutely normal the way it was before all of this happened, but I think starting with the fall of this year, we will gradually be able to do some of the things that we're not doing now, such as sports, such as indoor dining, such as entertainment, the things we've not been able to do. I would hope so. That will depend on making sure that we continue to adhere to public health measures and only gradually pull them back, and that we successfully vaccinate a substantial proportion of the population.
But I imagine we will be wearing masks for a while longer, right? Or
yes, I believe that until the level of infection gets very, very low, almost non-perceptible, I think we will have to wear masks. I think as more and more people get vaccinated, they would have the opportunity in their own homes, with friends, with family, to be able to safely interact socially without a mask. But that would likely be in very confined situations, like in your own home or in the home of a friend. But going out into society, I think it would still be quite a while where we will have to wear masks.
Now, you know, tourism is a big thing here in Greece. So I want to ask you, if a vaccinated American asked you whether he can come to Greece this summer, what would you say to him?
You know, I would depend on what the level of infection in Greece was. I mean, if the level of infection in Greece gets down very low and the Greek people get vaccinated so that they can suppress these surges of infection, I think gradually travel would be allowable and would be advisable, because everybody wants to get back to normal. And many people, myself included, feel that one of the most beautiful places to go is Greece. So I think people would want to do that.
Now, looking at at you on TV all this time, it looked like a very surreal experience when you were working with the previous administration. I wonder whether it was, and how it felt to be squeezed between science and politics in such a brutal way almost.
It was very difficult, and the only way I got through it was to focus on the importance of what I needed to do, would be to do the science and the public health that protects directly the American people, and then by that extension, indirectly, the rest of the world. because my job was to develop the vaccines, to develop the drugs, to be the public health spokesman. But you're right. It was very, very difficult because, as you know, I'm sure you do in your position as a journalist, you know that in the United States, it is a very, very divisive society. And one of the really difficult things to do is to carry out a successful public health endeavor when you have half of the country divided with the other half, and public health measures take on a political connotation as opposed to dissociating it completely from politics and just concentrating on pushing and pulling together. So the only way you're going to get through an outbreak is by everybody being together in a common goal. The enemy is the virus. The enemy isn't the opposition politically. The enemy is the virus. And that's what we need to do. Essentially join together against the virus.
You have dealt with AIDS, you have dealt with Ebola, now you've dealt with this pandemic. Is the next pandemic going to be different, the way we face it, the way the world faces it?
I hope that this very difficult experience that we have all gone through will provide lessons that we have learned that will help us both in the preparation for and in the response to the next outbreak, whatever that might be. And one of the things we've learned from experience, it is very difficult and generally impossible to predict what the next major outbreak is going to be. So we've got to be prepared. We've got to have good global health security network. We've got to have cooperation, collaboration, and solidarity throughout the world, because you never know where and when the next outbreak will occur.
And the last question is, if there's one moment, one episode that really sticks out in your mind from this past year, what would that be?
One episode. I think when we finally realized that we had a real problem in the United States where the virus was spreading under the radar screen, because we realized that a lot of it was spread by people who had no symptoms, which made it very, very difficult to track and do contact tracing. And as you know, right now, we have about 520,000 deaths in the United States, which is unimaginable a couple of years ago to think that we would have an outbreak where more than 500,000 people died from an infectious disease. That statistic sticks out in me in a very painful way.
Well, thank you very much, Dr. Fauci. It was really kind of you to be with us today, and thank you for all the great work. Hope to see you back in Athens at some point here in Greece.
Thank you. Nice to be with you. Take care.